And so we have to have some kind of hybrid system to work with the society that we currently have.
I
You
mean,
you
like
would you would
the
have
thing is,
to.
I don't see any issue if we had complete single payer. Like, what would actually be the actual problem? Because like when studies are made on this, when if America were to go to a either a single payer system or Medicare for all, we would actually save money because there'll be more preventative care actions. So why not
The
just do
pro-
that?
the
All right, Saved by Grace, how's it going?
Going good. How are you doing?
I'm all right. All right, are you? I know that you're 18 and you disagreed with something I have on the board. What did you disagree with?
Well, with just flat out listing them as flat out statements, I would disagree with portions of all of them. Just mainly because, let's start with the first one. I worked in healthcare, and I know the problems with universal healthcare as far as having a government run healthcare system. Usually, what the main problem is with government run healthcare systems is there's always ends up being a shortage of, which we already have issues in this area, but it's going to get worse with the shortage of doctors, physicians, nurses, and all that. Also, the other issue too is usually there's a backlog of needed life-saving surgeries that need to occur. A great example is up in Canada. Canada has one of the worst backlogs for surgeries. There have been people that die on a waiting list waiting for their turn to have surgery because the way they prioritize people's surgeries is basically causing people to let their problems get worse and worse and worse, and by the time they get in to get their care, things have gotten significantly worse from where they were. So either the surgery requires more invasive procedures, or they end up actually suffering detrimentally with increased morbidity and mortality. The There are balances that need to be met, both with providing a form of universal healthcare within a free market system. We've made steps in that direction, especially under Obama. However, the problem still is that we are a free market system. And through that free market system, we have free market healthcare as well. By the other issue, which is a main complaint by proponents that are against a universal type healthcare system, is that it usually increases general taxes overall for the entire population. People that are more sick versus people that are less often sick, they're paying the same fees for less coverage for the person that is healthier and takes care of themselves versus the people who don't take care of themselves. They end up with more severe medical issues and more complications, and more frequently need to see the doctor or other higher levels of care. So how is that justified on a closed system such as a government provided healthcare system? Other than I understand the human rights part of it, being from a healthcare working situation, I believe everybody deserves healthcare. It's just we need to make sure that it's as fair as possibly dealt with, so that there isn't these other ramifications that we've seen other countries have when they have this universal healthcare system.
Let me ask you
Uh,
a question. How come all the best healthcare systems in the world are universal systems?
that's a lie. That is flat out false.
What's the best healthcare system in the world?
It's probably pretty close between Europe, Canada, and the United States are all kind of within the same area.
It's Taiwan, and Taiwan has a universal system.
Oh, Taiwan's currently, they have a significantly smaller population as well, too, though.
So
That's a big issue. Smaller populations usually tend to fare better with universal systems, and that's a known statistic. The issue is when you start getting larger populations, larger land mass where that system has to be spread out, those tend to not have as good of outcomes, which is the issue with Canada, and their extremely high tax rates. And then also too with Europe, it also has similar issues as Canada does with the backlog of healthcare, backlog of surgery, shortage of staff, shortage of equipment. And
Taiwan doesn't have that. South Korea doesn't have that. Neither does
but then
Germany.
again, that just shows my example that smaller countries usually tend to do better with those systems.
South Korea
I
has a
agree. I agree with you to an extent that smaller countries do have a little better time with it. But you can even look at Cuba. Cuba does not have a very good healthcare system,
yeah, they do.
and
They're,
no, they don't.
they're a poor country because they've been blockaded, but their healthcare system is fine. They have some of the best doctors in the world.
No, they do not. They do not.
Yeah,
Again,
yeah,
I
they
come
do.
from the healthcare system. I'm Hispanic. I know for a fact they do not have one of the best healthcare
They they,
systems out there.
they have they
They
have
like
bad,
to say they do.
they have better
They like to
outcomes than
say
United.
they do, and usually
They have better outcomes than the United States does.
I disagree with that.
I know you disagree, but that's what the statistics say. They have better outcomes than we do, and they're
And
a
I've
third
looked at
world
the
country.
statistics too, and I disagree. I think you're wrong.
Okay,
As
fine,
far as
but what
guaranteed
I'm saying
housing,
is that when it comes to universal health care in this country, it doesn't have to be every doctor works for the every doctor works for the government, because we know that that doesn't work out very well. What I'm saying is that in this country, we already have a system for universal health care, and we are paying for it. We're just not receiving it. Why not just open Medicare to everybody?
I wouldn't actually have an issue with that as long as
That would be
because
universal health care.
this is what happened under Obama when that situation came up. He started opening up his program for having a reduced. If you had a lower income, they had a sliding scale program where you could even sign up if you made above the Medicare limit, to where you could go ahead and pay for that service. So, let's say insurance would normally have cost you $400 or $500 a month. They would put you on a sliding scale, drop you down to about 250 a month for the people that were just above the bump of Medicaid coverage. But also too, the option to keep your private insurance company, that was kind of a fuzzy water area as well. It goes back mainly to that we are a free market society. And so we have to have some kind of hybrid system to work with the society that we currently have.
I
You
mean,
you
like
would you would
the
have
thing is,
to
I don't see any issue if we had complete single payer. Like what would actually be the actual problem? Because like when studies are made on this, when if America were to go to a either a single payer system or Medicare for all, we would actually save money, because there'll be more preventative care actions. So why not
the
just do
pro-
that?
the only problem with single payer is that unless there is reform with how the billing is done, there can be issues with corruption within the billing cycles.
Like what happens now?
When I was a medic, let's just say, you go to the hospital, whether you're on Medicaid, Medicare, or whatever, the composition percentages that are calculated by Congress, those go based on insurance companies' recommendations for what their payout will be. So let's say you go to a hospital,
All right, all right,
they
hold
give
on.
you an
Give me a second, because we're kind of going a mile a minute. Yeah, so sure, there are issues with the, you will have to make sure that there are no issues with the corrupt billing system, but there's issue with the billing system right now.
Yeah, I know there is. Like I was going to give you an example. You go to you right now. You go to the hospital, but this is because of
Right. We
Medicaid
know
and
all that. What
Medicare.
the
You
discussion
get
is
a
more of why would universal health care in America be a problem if we just open Medicare for all, which is one of the ways that we can do it. Like one of the issues with the ACA is that the public option was dropped. You see what I'm saying? Like if we kept the public
yeah.
option, I don't think we would even be having this discussion, because like
Well,
he just let the state decide if they would expand Medicaid or not. My state decided not to do it, which means that even if you are a homeless vet, you will not get Medicaid. You see what I'm saying? Because you're not disabled, you're not pregnant, or you're not a child, or you're not or anything, any of those other things. So even if you're a homeless person on the street who clearly is debilitated and needs Medicaid, you will not get it because my state didn't expand Medicaid. You see what I'm saying? So
that's different per state.
that's
That
one of
is
the, is
Each
different per
state
state.
has
What I'm saying, yeah, exactly. It's different per
rules on
state.
that.
What I think is that it should be uniform over all state, where everybody is able to access health care, because
But
we
the
have
other
one of the
issue you're
worst
going to run
accesses
into
in this
is the
country.
United States primarily operates with a big emphasis on state rights. And so
Yeah.
that's another hurdle that you would have to jump over to get that.
No, we don't. Just have a public option, like how the ACA was originally supposed to have. Just do that.
As long as they left the public option open, I probably would not be against it as much. It's just I don't think we should switch to a complete universal healthcare system where that's the only option.
What, like they'll be able to get private options. You can have universal health
Yeah.
care and have private options, like Germany does that.
But see, you're not staying that when you state up here and you have your thing listed as universal health care. That provides the assumption that we're going to a single payer option and that's the only option. Because that's what people fear.
Yeah, I know that's what people fear, but that's just fear mongering. You know what I mean? And even if that was a thing, like so what? We know how crappy the healthcare industry is in this country. Like someone literally got unalived because of how fucked up they are. So
That still doesn't mean our country's healthcare system is crappy. Like I said, I worked
no,
in
it's
it.
pretty shitty. It's
It's
pretty
a
shitty.
very good healthcare system.
No, like the doctors and the nurses, the healthcare workers are good. The system sucks.
Again, I disagree slightly just because I came from that background and I know
Let me ask you,
I know that it
someone
has
who
problems, but I know that it also has a lot of good things for it too as well.
let me ask you this question: someone who looks like me, am I likely to get good care?
Yes,
No, I'm not.
yes, you are.
No, I'm not. Not
Now I
according
know
to
there have
not
been
according. Hold on, wait.
statistics,
Not according to research. According to research, someone who looks like me is gonna be seen as more aggressive, as more drug seeking, and someone who looks like my wife can probably is likely to die in childbirth because doctors don't care about black women's pain. This has been shown.
that wasn't a universal study. That was a study of individual hospitals within a specific regions of the country,
There's
and they
universal
noticed
studies, bro.
that it was only in those specific regions that they were having those issues. It wasn't general in all regions throughout the United States.
Yeah, and the regions that they studied were the Midwest, the Northeast, the South, and the West Coast.
The Midwest, the Northeast. Now, the ones that I saw were primarily the ones that were done in Texas, the one that were done in California, the ones that were done along the East Coast. But I wouldn't say it was throughout every single state that it was in.
Yeah, there was and then there was a study done in the Midwest as well. It's been done in all the regions, and they found the same problem.
Okay. I'll have to look into that a little bit more to see. But I do. I was going to say I do know some of the studies that people that people of color, and I'm one of them too. I the do have an issue where you have a white patient versus a black patient, and the black patient, both of them had cardiac arrest, and the black patient got 7 minutes of CPR, but the white patient got 34 minutes of CPR. And
Yeah.
that's a major problem. I mean, that kind of stuff where I worked, that wouldn't fly. I never saw that kind of stuff happening.
Right. I'm pretty sure individual hospitals are good, but overall, I'm pretty sure individual hospitals are good, but overall in the system, like there's still discrimination that exists against people of color.
Yeah, and it should happen. It should. I don't think it's systemic. I think it's individualistic, and I think those people should definitely be caught. There
If
needs to
it's
be more
individualistic
oversight.
and if it's individualistic and not systemic, how come all the studies find it to be endemic in all the systems, like systemically? Like it keeps happening over and over and over. Like if it wasn't systemic, it wouldn't be a statistical like significance, but it is.
Well, I qualify as systemic, meaning that the corporate policy is to do
That's
this.
not what systemic means.
I agree that there's a lot of racism out there, but I agree that it's usually person by person decision making that
It's
they're
not,
doing
bro.
that is causing it.
It really isn't. It really isn't. I don't know if it's a lived experience for you, but it is a lived experience for me. It really isn't. It's not just individuals. Like the whole system goes against you. Like if we do out there go out there and do research and we see that statistically this keeps happening to a certain group of people, we just can't say it's individual at that point.
But the fix is more oversight because one of the issues with oversight within the medical industry, I even caused a patient review with one of the hospitals here because I didn't like the way the doctor treated the patient. But this had nothing to do with race. The When the hospital has an incident, a lot of times they'll do a medical panel to review the incident, and they'll basically give the doctors a lot of times a slap on the wrist. They don't pull their license. They don't get any kind of major punishment. They do it as only a teaching situation. There needs to be a little bit more accountability for malpractice that occurs, whether it be due to negligence, due to racism, or what have you. I agree that needs to be put up front. But I don't know if I could be convinced that there's full on systemic racism to the point that is just overall causing people to die.
Okay,
other
so
than there
I'll
have been
then
instances.
if that's the case, if you don't think that's the case, then you have to deal with like research year after year showing that yes, black women are more likely to die in childbirth because doctors are ignoring their pain. Black men are seen as aggressive and drug seeking. Like this happens
There was
every single study in every single region, every
yeah,
single
but
time. If
there
it's
was other
not,
factors too.
if it's not like if it's not systemic like how you're saying, why do these studies keep finding these things? We just can't say it's not systemic at this point. Yeah. Nurse AJ brings up a good point. Medical apartheid. That's why I brought her up here. I know she wants to say something about this. We do have about 5 minutes left. So
Okay.
Nurse AJ, I'm gonna let you go, and Marana, you're gonna be next. Nurse, go ahead.
Good evening, everybody. I kind of jumped into the middle of it, and I heard it. Sir, I'm not sure. What's your credentials, sir? The one down here at the bottom.
I was a paramedic and a CCT medic.
Okay. So you're a paramedic, so you are largely outside of the facility. I am a registered nurse. I am certified in multiple specialties and hold a couple of different degrees. I have spent my career in a safety net hospital here in a large area. And I also serve the underserved population. Sir, I am here to tell you that the practice of medicine embedded in it is systemic racism. Up until recently, and I'm talking about pre the year 2000, it was still being taught that Black patients don't feel as much pain as white patients. It was being taught that our skin is thicker than a Caucasian patient. There's
Well,
implicit biases in the training. Okay. And again, because I work at a safety net hospital, it's mostly filled with people of color. And one of those disease states that over and over and over again gets mistreated is sickle cell. The sickle cell patients are largely African American or Black. Okay. These patients over and over and over again get labeled as drug seeking. They don't, it's a very painful disease state. I have watched them time and time again not want to give proper pain medication, deny pain medication, put limits on pain medication for sickle cell patients. I have and I am just to let you know my actual training, I am a surgical nurse, trauma nurse by trade. I
good for
spent
you.
most of my career in the PACU and most of my career in surgical specialties.
Yeah, PACU's Nurses Rock.
I've seen a lot of different surgeries and a lot of different procedures and a lot of the pain medications that they do not give certain patients. I've seen that with my own eyes on my own charts that I have worked. I have seen that. I have seen patients with amputations since I work in surgical specialties. So that means I support podiatry a lot. And I have seen them give both patients, no rug history, but one patient that happens to be of one skin color and nationality gets a certain amount of pain medication and the other does not. Now, this varies greatly from the safety net hospital that I primarily work at to the surgery center that I do some PRN work at, because those are all commercial paying patients, not Medicaid or other charity patients. So it varies on class. And we can't fool ourselves and act like this problem doesn't exist. Acting like it doesn't exist doesn't solve the problem, doesn't take it away. Heading it on, understanding what it is, dealing with it, and re-educating is how you start to solve the issue.
No,
Not by
I understand
not
your
trying
point
to
of view.
talk it away. It doesn't happen.
All I was saying though is from my experience, and I understand that I don't have the experience within the hospital setting as much as you do. In my experience, I never was told in any of my medical classes that those stereotypes that you stated about blacks having thicker skin or that they can deal with pain better or any of that stuff. That was never anything that was taught. So I don't think that that is universally taught in medical school, but it is a problem within the hospital atmosphere that I don't know where it comes from, but that definitely wasn't anything that I personally experienced or was taught or trained on. You know, I've dealt with patients that have had sickle cell. My heart always goes out to them. I mean, that's got to be just one of the shittiest things to have to deal with, especially for the kids when they first start having those issues. And I understand how life threatening it is. The you know there are a lot of problems that are dynamic within the healthcare industry, and I agree that there needs to be a lot more focus on studying where these problems are occurring, which doctors, which staff members are causing this to perpetuate, and there needs to be accountability. But as in my experience, and I'm sure you've seen it too, is there is a lot of times the accountability strikes the lower level employees and not the higher level employees that are within the hospital settings. Usually the doctors are not the ones that are losing their jobs over mistakes that they're making. It's usually lower level staffs, a lot of times the nurses and under.
All
I
right, we
mean,
have about 1 minute left, and I'm gonna have to move on to Morana. I do appreciate both Saved and Nurse AJ for being up here. You guys can stay if you like, and we'll continue the conversation in a little bit. All right, but I
I'll
appreciate
drop
you
out,
both.
but